Welcome to the first episode of Mindful Medicine. I'm your host, Tracie Jones, and we have Dr. Jim Schrenker here with us. Dr. Schrenker, could you tell us a little bit about your background?
Yeah, I'm traditionally trained in molecular biochemistry at Indiana University, and then I went on to medical school at Indiana University. I did residency program down here in Bristol at Bristol ETSU Family Practice. I've been in private practice now for about 30 years. Started off as a conventional family physician, delivered babies, took care of nursing home patients, inpatients, and then treated patients as outpatient setting. Gradually realizing throughout my career that the patients that I treated didn't necessarily get better. And the ones that got better didn't necessarily follow my advice. Pushing more medicine on people wasn't the answer. We controlled their disease process, but that's all we did is we managed it. We didn't reverse it. Patients weren't as excited, they weren't as happy, and they weren't as healthy as they are in this section of my career.
So after some time in conventional medicine, what brought you to the place then that you decided to open a private practice?
Well, when you're doing a conventional medicine practice, and it's nice to have partners because everybody thinks alike. When you start thinking differently, when you start understanding that the human body can heal itself, when you start understanding that it isn't about a number on a piece of paper, it's about how happy they are or how well they are, then a lot of that gets lost in translation and the people around you don't understand what's going on. So at some point, you come to the conclusion that I'm probably going to be better off being on my own than with other groups or being with other like-minded physicians. So I retired from medicine back in 2005 from conventional medicine.
So was that a tough transition to make?
It was extremely easy to fail at, is what it was. When I started practice in 2005, my cup was very full. I knew everything that there was to know about alternative and holistic medicine. So I opened up a clinic with an acupuncturist, a Reiki specialist, a hypnotherapist, reflexologist, and a massage therapist. And we were going to transform the consciousness of medicine immediately because people were going to flock to us because this is such a better way to be. After that 3-year fellowship, shall we call it, because I learned a lot. It was not wasted time. But after 3 years, I realized that was not going to work. Wouldn't work in Tucson, Arizona, and it sure as heck didn't work in Bristol, Tennessee. People are unwilling to pay cash to get better most places, but especially here. So I learned a lot about energy. I learned a lot about just the way the body works from a spiritual basis. And then I was able to transform it into something that we have today.
So tell me, if I come to you as your patient, what is going to be your approach?
So we take all insurances. So we abide by the insurance regulations as far as that goes, as much as we can. Which means that we'll see you, we create a diagnosis, and then we draw blood work and do tests based on the diagnosis that we have. So we would do an extensive blood panel on you, checking a full thyroid panel, checking your hormones, checking vitamins, minerals, making sure that every aspect of your biochemistry gets examined. From there, we would see you back and we would review that. If we needed any diagnostic tests to help us out, we would go down that path and get those. And then eventually come up with a treatment plan. That treatment plan is going to be 3-pronged. There's going to be a biochemical treatment plan. Your body is out of balance. This is what you need. From a supplement standpoint, maybe a pharmaceutical standpoint. We're going to get the biochemistry back into balance. From a spiritual standpoint, we rely on Reiki, acupuncture, massage, body work, hypnosis, things to bring the spiritual nature back into balance. And then if you put both of those together, you kind of get a better human being. You get the whole body, mind, spirit balance if you approach it from that direction.
So let me ask you this. If I come to you and I am on a blood pressure medicine, how do you handle that? Do you just say, oh, you shouldn't take pharmaceuticals anymore? Or what would you do there?
No, first of all, we want to make sure that you're healthy. And you're going to be healthier with a lower blood pressure. And you can take Hawthorne, and you can take arginine, and you can spend $40, $50 a month and take a medicine 3 and 4 times a day and do the same as 10 milligram lisinopril. Or you could take your $4 lisinopril and not have to mess with all those supplements. So we're not in the process of stopping the medication. We're in the process of trying to help you get better so you don't need the medication. So that would be diet. That would be smoking cessation. It would be lower sodium, more exercise. But hypertension in and of itself is just as much spiritual imbalance as it is dietary. Most people with hypertension would want things done yesterday. They get very upset very quickly. They're very hot-headed, hold themselves responsible for a lot of stuff, and kind of have a lot of inner tension. So again, Reiki would work there too. Keep them on their lisinopril, see how much they're willing to change their lives. If they are, then all of a sudden their blood pressure will start to drop and we can get rid of the lisinopril and not need a supplement either.
So this sounds like a more longer-term approach, but one that does completely transform your life and change things for you for the long haul. Is that what I'm hearing?
It can if you allow it. Remember, you're always in charge. Whatever you think is going to happen is actually what's going to happen. So if you want to change your life, then yes, this is the place to be. This is the approach to use, shall I say. Change your diet. We want a plant-based diet for most human beings. Mediterranean diet is a great example of that. You want to get rid of processed food, and we can speak volumes on diet, and we'll have the dietitian on later to help us with that conversation. But change your diet, change your spiritual nature. How many times a day are you being mindful? Simple. Be mindful for 5 minutes before your feet hit the ground in the morning, and be mindful for 5 minutes before you shut your eyes at night, and go through your thankful list. Release anger, release guilt, release shame every day, multiple times. So eating clean food, exercising your mind, and of course exercising your body for as much as you can based on your age and your abilities.
So it sounds like that you're not just a doctor. If I come to you, you are a counselor. You provide spiritual direction.
Yeah.
You look at someone's whole life,
Right.
Not just their symptom.
Right. It's not about a number on a piece of paper. It's about creating a better human being. It's about getting that human being to live in this life with love and peace and joy, learning forgiveness, especially forgiveness of self, balancing that energy, getting the healthy food in there so your body can repair itself. One of the analogies that I always use with patients is, if you got grass and mud, you can make a hut. But if you got a platinum card at Lowe's, you can make a home. So you got to have the building blocks there in order to do it, or it just doesn't work. So I think the big thing with our approach is one of the biggest, if not the biggest building block to wellness is the spiritual balance, is the energetic balance.
Could you talk a little bit more about the energy?
Yeah,
Just explain a definition of what energy is.
For about 3 years, I could talk about that. But energy is physics. It's not woo-woo. It's not passing your hands over somebody and doing a Reiki symbol or things like that. That's part of it. It's physics. If you look at the data from the Large Hadron Collider over in Switzerland, you find out that you got an atom with subatomic particles, with particles that are smaller than subatomic particles. But then eventually, when they collide together, you get a release of energy, no more particles. So from a physics standpoint, all physical matter starts as that universal energy. And you can put whatever name you want on that universal energy. But that universal energy comes together as quarks, and then gluons and gluons and atoms and then molecules, and then it gets together as DNA and nuclear material, and then it creates life, and then it creates humans, and then all of a sudden we have a consciousness in there. So we are complex beyond complex, but the very foundation, the very fabric of who we are is energy. And you can't fix the human being without repairing the energy. And I think that's our biggest asset here.
Okay. Well, thank you, Dr. Schrenker. That is very exciting, and I look forward to going more into depth about a lot of these things that we've talked about today, just so people can learn more and be educated about their whole self and whole wellness. So thank you to all of you who are listening today to our first episode of Mindful Medicine. And remember, as always, you are loved.